The Presidential Task Force on COVID-19 was established by President Muhammadu Buhari in March 2020 to contain the spread of COVID-19 and mitigate its impact in Nigeria. It provided policy direction and coordination, emergency operations center coordination, interventions and protocols, resource mobilization, stakeholder coordination, risk communications and mobilization. The PTF is led by 15 representatives. The task force implemented the COVID-19 response through 11 pillars: case management, epidemiology and surveillance, laboratory, infection prevention and control, point of entry, risk communication and community engagement, resource mobilization, security, logistics and mass care, research, state coordination and government relations, sustainable production group. Scaling the response. With a data-driven approach, the PTF mitigated the COVID-19 pandemic by implementing and easing a national lockdown, monitoring daily cases, developing safety and testing protocols, sensitizing and mobilizing the public, deployment of aid and palliatives, strengthening Nigeria's healthcare system. With these measures, the task force successfully reopened businesses, government offices, schools and places of worship, resumed domestic and international travel, commenced NYSC activities, while mitigating the spread of COVID-19 through the National Pandemic Response Center with strategic support from its secretariat. Rallying partners. The PTF collaborated with federal, state and local governments, the private sector, foreign governments, international partners, bilateral organizations, donor agencies, community and religious leaders, the media and civil society organizations for a coordinated response. For example, the Nigeria Governors Forum aided state and local government alignment. Coalition Against COVID-19, CACOVID, procured and delivered over 11 million relief items. The United Nations system provided financial and technical support. Over 60 media partners facilitated risk communication and public awareness in 12 languages across print and digital platforms. Measuring impact. Nigeria's health infrastructure and emergency response were strengthened while mitigating the spread of COVID-19. For governance, transparency and accountability, the PTF launched the Incidents and Response Tracker developed by the Nigerian Economic Summit Group to track state demand and resource allocation, and Resource Tracking Dashboard developed by the United Nations Development Programme to channel COVID-19 financial response. The task force has transitioned its activities to federal and state governments to ensure the response is sustained. Its partnerships and one government approach have helped foster a sustainable national COVID-19 response. Scaling the response, saving lives and transitioning to recovery.
We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
The whole instruments of government are now mobilized to confront what has now become both a health emergency and an economic crisis.
Our national response in year 2020 has been about deploying several non-pharmaceutical measures for the 1, interruption of viral transmission, 2, reducing the risk of the health system being overwhelmed due to increased demand, and 3, minimizing mortality among the most vulnerable parts of our population. In addition to the protocols and these non-pharmaceutical initiatives, the PTF in 2021 will focus on the hope offered by the arrival of vaccines. It will be MPIs plus vaccines. Nigerians are assured that when the vaccines come into Nigeria, they will be safe for use, effective for protection against the virus, and delivery will be timely and cost-effective. The PTF urges Nigerians to remain resolute, not to be fatigued, to be vigilant, and to stay safe always. Thank you.